Hey guys, how are you? So this is going to be a quick video, but I'm doing it so I can cover flow rate with you. A very good friend of mine, and that's the only reason I haven't blocked her because she's a good friend of mine, but she's in the nursing program and she's stalking me, guys. I mean, she calls me over every little thing. I feel like before she even studies, she just calls me, listens to me talk on the phone, and that is her studying. She's driving me crazy. But anyway, she's doing dosage calculations. She's freaking out. And I'm telling her it's easy and she didn't believe me. And I taught it to her in 5 minutes. It's not hard at all. So I'm going to show you the formula that I use. These are the two formulas. I don't know the shortcut method, so I can't show it to you. I'm just going to show you the method that I use, and that's what works for me. And the method that I use to figure out what my flow rate is going to be is my volume times my drop factor all over time in minutes. So I'm going to write that down on this so you can see volume. Your volume, that's going to be your ml times your drop factor all over time in minutes. And this is how we're going to figure out our flow rate. So we're going to start with number one. So let me put this paper over here and you can see it side by side, okay? So number one, it says 3,000 milliliters of half of sodium chloride IV for 24 hours. The drop factor is 15. What are you going to give? Let's plug in our numbers, guys. The first thing we're going to start with our volume. What's our volume? Oh, I'm up here. 3,000 ml. That's what was given to us, guys. So we're going to put that in. 3,000 ml times drop factor. They give it to you. The drop factor is 15. All over what? Time in minutes. What's the time they gave us? 24 hours. But are we done? No, because remember, guys, the time has to be in minutes. Right now it's an hour. So how do we turn that time into minutes? All you do is multiply whatever hours you get and multiply that times 60. Why? There's 60 minutes in each hour. So when you do your hour times your 60, that's going to give you your time in minutes. So now that we have this set up, now let's do the math, guys. So, pull out your calculators, do 3,000 times 15. Let me pull mine out as well. Okay, 3,000 times 15, that should give me 45,000. And now you do 24 times 60. 24 times 60, that should give you 1,440. So now you just divide your 1,440 into your 45,000. What does that give you? That should give you 31.25. So is 31.25 our answer? Absolutely not. Remember, guys, we're talking about flow rate. I want you to think about the IV that's dripping into a patient. Drop, 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 drop. You can give 1, you can give 2, you give 200, you can give 250. You can't give 2.5 or 2.5. Think of a raindrop. Can you split a raindrop into a tenth or 100? It's 1 drain drop or 2 or 3. It's going to be a whole number. So this 31.25, you're going to look at what's in the tenths place after that decimal. If it's a 5 or higher, you're going to go up. That 31 would have been a 32. But since what's in that tens place is smaller than a 5, we're going to keep it at what it is. So that 31.25 is what? 31. 31 drops per minute. And that's your answer. 31 drops per minute. Okay, you just plug them in where they belong. Let's do the second one. It says 200 mLs of D5W IV to run for 2 hours. You have a micro drop of 60 drops per milliliters. What's your flow rate going to be? So let's plug it in. What is our volume? 200. Remember, here's our formula, guys. Volume times the drop factor all over time in minutes. So now let's look to what the drop factor is, 60. They give it to you, guys. So let's put in our 60. All over time in minutes. What's our time? 2 hours. So are we just going to put a 2 here? No, because remember, our time has to be in minutes. So we're going to do 2 times what? 60. Very good. So now we can do our math. So let's start. 200 times 60. My 2 times 6 is 12. I'm going to tack on my zeros. 1, 2, 3. 1, 2, 3. So 12,000 all over 2 times 6 is 12. And then I'm going to tack on my 0. So I'm going to do 120 into 12,000. Bust out your calculators. Sorry, 12,000 divided by 120. And did I do that right? 6 times 2 is 12. I got my 12. 1, 2, 3, 1, 2, 3. 6 times 2 is 12. Oh, let me do my calculator again. Hold on, guys. You guys are faster than me. Okay. 120 goes into 12,000 what? 100 times. So are we done? No, because you guys will get it wrong if you don't tack on your 100 what? Drops per minute. And that's the correct answer. We put in our volume. We put in our drip factor. We put in our time, but remember the time they gave us was in hours, but we needed in minutes, and that's why we multiplied by 60 to set up our equation. Okay, let's do number 3. So it says 1,000 cc's. By the way, guys, cc's and milliliters, same thing. 1,000 cc's normal saline IV for 24 hours to keep the vein open. The drop factor 60. So let's do this math. We're on number 3. Oh, I skipped one. I'm sorry, guys. Here's number 3. 800 cc's or of D5 1/3 normal saline IV for 8 hours. Your drop factor is 20. Look how they try to trick you with this 1/3. Do we care about that 1/3? No, we don't. Because what we care about is the fluid volume, and the fluid volume is 800 cc's. So that's what we're going to plug in as our volume. So we're going to put our 800 times our drip factor, which is 20, all over time in minutes. What's our time? 8. 8 what? Hours. But our time has to be in minutes. So we're going to go ahead and multiply that by 60. Let's do that math. 8 times 2 is 16. I'm going to plug in my zeros. 1, 2, 3, 1, 2, 3. And then 8 times 6 is 48. Plug in my 0. How many times the 480 going to 16,000? Let's bust out our calculators. 33.3. So is this our answer? No, because remember, your flow rate has to always be a whole number. So that 33.3, let's look behind the decimal, and behind the decimal is a 3. That 3 is less than 5, so I'm going to keep that 33. My correct answer is 33 drops per minute. If this 3 were a 5, that 33 would have turned into 34. But because it's less than 5, it remains, and we keep it as 33. All right, let's do number 4. Number 4 is 1,000 cc's normal saline IV for 24 hours to keep the vein open, and a drop factor 60. So let's go ahead and plug in our numbers. Volume is 1,000. Drop factor 60. Time in minutes, they gave us 24 hours. But because they gave us 24 hours and not minutes, we have to go ahead and multiply by 60. So do 1,000 times 60. And that gives us 60,000. And on the bottom, you do 24 times 60. And that gives you 1440. Now we have to see how many times does 1440 go into 60,000. So go ahead, do that math. 60,000 divided by 1440. And that gives us 41.6. So 41.6, is that our answer? No, Professor D, because it has to be a whole number. So what do? We look at that tens place behind the decimal. It's more than 5. What does that mean? That means this 41 goes up. It's now 42. So the correct answer is 42. Can I leave it as 42? Absolutely not, because your teacher will mark it wrong. You have to always have your unit, whether it's microgram, kilogram, milliliter, drops per unit. You always have to have your unit. So I'm giving 42 what? drops per minute. And we'll do one more. We'll do one more, guys. And the next video I'm going to do for you, we're going to have the same situation, but they're going to add something to it. So for example, the doctor ordered for that med to go in 8 hours, but you come back 4 hours later and more than half was given or less than half was given. They tell you what was infused into the patient. I'm going to show you how to calculate your new drip rate, okay? But for now, we're starting off with the foundation. You got to get this before you can get the next one. So let's do number 5. Order, you have 1,500 milliliters of D5W IV for 12 hours. Your drop factor is 15. Let's plug in our numbers. What's our volume? 1,500. I'm going to multiply that times my drop factor, and they give that to your 15. All over time in minutes. And again, number 5, they give it to you in hours, 12 hours. But remember, we need the time in minutes. So we're going to multiply that times 60. So do your math, 1,500 times 15. And that gives you 22,500. All over 12 times 60. And that's 720. Now you need to do the math. How many times does 720 go into 22,500? So go ahead, plug it in. Do your 22,500. Oh, 22,500 divided by 720. And your answer is 31.25. 31.25. Can we leave it like this? Absolutely not. It has to be a whole number. So let's look at what's in that tens place behind the decimal, a 2. That's less than 5. So we're going to keep that 31. Our correct answer is 31 what? Drops per minute. That is our answer, guys. And just so you know, because all of these anyway, they give it to you in hours. Let me show you. They give them to you in hours. But let's say you had a question that the time they gave you was not in hours. They gave it to you in minutes. You don't have to do times 60. The only reason we're doing times 60 is to turn it into minutes. But if they tell you 45 minutes, 30 minutes, 20 minutes, on the bottom number, that number we have down here, you're just going to write down the minutes that they gave you. We don't have to do times 60. The only time you do times 60 is when they give you the time in hours, and we need to convert it into minutes. So guys, easy peasy, lemon squeezy. Next video on dosage calculations, I'm going to help you know how to calculate if you come in after X amount of time and there's a certain amount that has gone into the patient and you have to recalculate your dosage. I'll teach you how to do that. Guys, I hope this was helpful to you. And if it was helpful, can you pray that my friend stops stalking me? She's taking advantage. She is driving me crazy. All right, guys, thanks for watching this video. And make sure you guys are watching my YouTube videos, please. You guys are telling me all the time, Professor D, you helped me so much. I passed, I did this, I did that. The best form of supporting me and showing appreciation is by liking my videos, subscribing to my videos, and sharing my videos. Please share my content on your social media platform so more people know about me. Guys, thank you so much for watching, and you'll see me on the next video.